Hello, my name is Professor Charles Kingsland and I'm the Chief Medical Officer at Care Fertility. And I've been asked to give you some information as employers as to what infertility treatment involves, to give you some understanding as to how to expect your employees to behave or the time they may need off during their fertility treatment. I'd like to just briefly mention mammals, because mammals, we're humans, we're mammals, we have the same characteristics, whether you're a dolphin or an elephant or a human. We move, we breathe, we grow, we reproduce, we respond to our environment, we eat and we die. And these are our biological drives. So if one of them is impaired, we will react accordingly. So if I was to say to you, you can't eat for a fortnight, I can guarantee that the following day, all you'll be thinking about is food. Similarly, if I said, don't breathe for 20 minutes, in a minute, you'll be thinking about breathing in and out. And the same is for fertility. So if you have a fertility problem and you can't reproduce at a time in your life when you want to, it becomes very, very anxiety provoking. All you think about every minute, of every hour, of every day, of every week is babies. And then your mind starts playing tricks on you. Everybody's pushing a pram. All your friends are pregnant and you hate it, but you feel sorry for them because it's not their fault. Every shop on the high street has baby clothes. And as a patient said to me very recently, Professor Kingsland, I could go into any supermarket anywhere in Britain with my eyes closed and I will find the nappy aisle. So this is the first thing about fertility or infertility. It is very, very anxiety provoking. And this might manifest itself with sickness, with time off work, with depression, particularly if they can't get the treatment that they need. The treatments for fertility are surprisingly simple. There are very few major operations concerned in things like IVF, for example. And very little time is needed to be taken off work. So the first part of fertility treatment will usually involve hormonal therapy. And hormones, the side effects can cause bloating, they can cause irritability, hot flushes. But you can quite safely, in the majority of cases, go to work and suffer those symptoms that will be minor in most cases. Fertility treatment like IVF will involve scanning, and they can be done like a routine general practice appointment. It only takes 10 minutes to do a scan, but if you're having treatment in a hospital, you may take an hour here and there, 2 or 3 times over a couple of weeks to have that time at the doctor's. Then we have the egg collection. Now the egg collection is the most involved procedure. It's a minor surgical procedure, and most patients would want to take the day off and maybe a day afterwards if it's uncomplicated. Similarly, after the embryos have been created, then the embryo transfer, where one embryo is put back into the patient's uterus, that's usually a very simple procedure and can be completed in half a day. So time off work is actually minimal unless there are complications, which are unusual, but they can happen, in which case they might involve taking maybe an extra week or 2 off. Other patients after an embryo transfer will get very stressed again and will want to take time off either with a sick leave or as annual leave. And that really is up to them. It will not improve the outcome by taking time off work and resting. It does not necessarily improve outcome, but it may put their minds at rest. And that, of course, is at the discretion of the employer whether that should be allowed, but it doesn't necessarily. In fact, in many cases, it might be better for patients to actually carry on the daily duties. But finally, the biggest impediment to treatment that we find is that employers or patients will come to me and say, my employer doesn't understand, so I have to hide what I'm undergoing, and I pretend I'm doing something else. And even in the past, I've written letters that say, please excuse this patient for work because she's undergoing acute gynecological treatment. So I would say one thing to employers, which is the most important. I would suggest that encouraging openness and honesty can be one of the most beneficial therapeutic effects that you could bestow on your employees at this particularly difficult